Thank you for inviting me to speak today at the HER2 Positive Breast Cancer Community Forum. My name is Wanda Tsui. I'm a breast medical oncologist at the Peter MacCallum Cancer Centre with a special interest in breast cancer prevention, as well as prevention of longer-term consequences of cancer treatment. Thank you for sending in your questions, which I have them listed here, and I'll be going through these systematically today. Regarding your first question, can you tell me a bit about what led you to become a researcher? Well, there were really two major factors, I think, that led me to become a breast cancer researcher. The first is really being a clinician. I wanted to improve outcomes for my patients. And that meant I wanted to improve cancer outcomes in terms of survival, increasing cure, and reducing the chances of relapse. But I also wanted to improve the quality of life of the patients I was seeing. I also wanted to try and minimize short and long-term side effects of the cancer treatments we deliver. And really the ultimate goal is to improve the survivorship experience for patients who are diagnosed with breast cancer. The second reason was to understand breast cancer better. Because by understanding the cancer better, potentially we could improve on treatments. We might be able to improve personalization of treatments. Some people might need more treatment, some people might not need as much. And I think that this is important in terms of informed decision-making and being able to guide people in terms of deciding what's the best treatment for them. I think the other important thing about understanding breast cancer better is also about prevention and whether or not we can prevent women from and men from developing cancer in the first place. Regarding my research, I'm a PhD student as well as a medical oncologist at the Peter MacCallum, and my PhD is currently looking at improving our knowledge on the impacts on fertility and ovarian function of our cancer treatments, and really understanding what the longer term impacts of our treatments are. The ultimate goal is to be able to empower people to make more informed treatment decisions when weighing up the treatment options offered to them when they know the longer term consequences. The other trial that I'm currently involved in is the Decrescendo trial, which is run through the Breast Cancer Trials group. This is a trial in patients with HER2 positive breast cancer, and it's looking to try and optimize treatment and try and select for patients and people who could potentially avoid quite toxic anthracycline chemotherapy, which we know can increase the risk of subsequent cardiotoxicity, as well as secondary leukemias and ovarian failure. I've put the schema of the Decrescendo trial here for your information. In this study, what we're including women who have, and men who have HER2 positive, hormone receptor negative breast cancers, which are bigger than 15 millimeters, but smaller than 50 millimeters, who do not have involvement of their lymph nodes. All patients on this study will have a combination of two HER2 targeted therapies called pertuzumab and trastuzumab with chemotherapy called paclitaxel or docetaxel. They have this treatment initially before having surgery, and then the treatment after surgery is dependent on how much tumour is left at time of surgery. If there's no tumour left at time of surgery, these people will continue on with pertuzumab and trastuzumab by itself, and therefore avoiding potentially toxic anthracycline chemotherapy. If there is a little bit of residual disease at the time of surgery, people will receive a treatment called TDM1, which is what our standard of care currently is in people who have some residual disease after surgery and chemotherapy before surgery. If there is a lot of residual disease at the time of surgery, these patients will receive the anthracycline chemotherapy as well as TDM1. So they would have received what they would have as part of standard of care. This trial will follow up patients for 4 years. And importantly, we will also be monitoring in premenopausal women what the ovarian function changes are pre-treatment and post-treatment to understand what these drugs do to fertility and ovarian function. Regarding your next question, challenges in helping patients understand treatment options and clinical trials that are available. I think in terms of understanding treatment options, there are often a number of treatment options for people with breast cancer, and decisions can be complex. The treatment regimens can be quite complicated with multiple agents, and you might start off with a couple of agents and then halfway through the regimen that changes. I think also it can be quite difficult and quite overwhelming to understand all the possible side effects and and their management for you personally. And that really makes that individual decision about which treatment is best for you quite difficult, and certainly something that as a clinician, we try and guide our patients through in the clinic. I think the other difficulty is clinical trials in oncology is a standard of care. It's, it's the way that we advance our knowledge and our treatment strategies and improve outcomes for our patients. But I think that concept of it being a trial and the treatment being experimental can be quite difficult to get your head around, I guess, sometimes, and that fear of being potentially given less treatment than what you should be receiving can be also difficult to come to terms with. In terms of things that can be difficult to understand with regards to clinical trial options, I think one of the difficulties is knowing what is available and where it is available. And we know that some trials are only available at certain centres, and that may not necessarily be easily accessible to people who might live further away. Sometimes these trials can have quite long patient information sheets, and understanding what the rationale of the trial is really important for patients to be able to make that decision if that's something that they want to participate in, and certainly something that we try and be very clear about when discussing clinical trials. I think it's also important to discuss what the options are if you don't participate in the clinical trial in terms of helping with that decision making. And certainly, especially for some of the earlier stage trials where we have less experience with the medication, there are uncertainties regarding what the outcomes might be and what the side effects might be. And that can also make it difficult to understand and to make a decision about whether or not this trial is for you. The next question I had was, what do you see as the main factors that could impact on quality of life? And I think that this can be split into three major factors for people with breast cancer. The first is the physical factors from not only the cancer, but also the cancer treatment. We know that the cancer can potentially have symptoms, can cause symptoms, especially in the metastatic setting, but also we know that treatments can cause side effects. We know that the cancer and the treatments can cause changes in appearance, things like hair loss, as well as surgical changes, especially surgical scarring, and consequences of surgery, such as lymphedema in some people. But we also know that in the longer term, there can also be changes, things like early menopause, changes in your sexual function, in your libido, as well as your fertility. And these are things that are major factors on quality of life. I think that equally as important are the psychological factors. A diagnosis of cancer is devastating, and I think that that has a massive impact on quality of life, not from the start, from the get-go, but also through your cancer journey as well, because fear of recurrence after treatment is common, and it can be quite impactful on your experience of after finishing treatment. I think also sometimes it can be helpful to know what other people have gone through in the same situation as yourself, but also sometimes that can be difficult, especially if you're having more side effects or having more difficulties than what you see reported in forums or on support groups. And I think lastly, one of the unseen factors of impact on quality of life is the social impact of the cancer diagnosis. We know that the diagnosis and treatment can significantly impact on your family and social life, but also it impacts on your ability to work or your want to work, and it can be quite a significant financial burden for some people as well. The next question that the forum asked was, what are some of the most promising treatments that are coming through for HER2 positive breast cancer? And the main two promising treatments I'd like to cover today are two drugs that are currently have currently been studied in the metastatic setting, but hopefully potentially coming into the to the early stage setting. The first is a medication called trastuzumab deruxtecan, or TDXD, and the second drug is called tucatinib, which is given in combination with Herceptin or trastuzumab and capecitabine. Regarding trastuzumab deruxtecan, this was studied in the DESTINY-3 trial, which has now been published, in patients who had metastatic HER2 positive breast cancer who've previously received prior chemotherapy and trastuzumab. In this study, patients received either TDXD or our standard of care, which is TDM1. And what we can see at the top of this slide is that TDXD significantly improved the rate of progression at 12 months. So with TDXD, only 25% of patients had progressed at 12 months, compared to TDM1, where almost 65% of patients have progressed at 12 months. The bottom graph shows the life expectancy or the overall survival. Unfortunately, we don't have enough follow-up time for this study to know whether or not this drug will impact or improve overall survival as yet. And this is data that we're eagerly awaiting. Although the results are quite impressive, we do know that this drug does have significant side effects, and that needs to be weighed up when we decide if this is the appropriate treatment for patients in the clinic, if it becomes available in Australia. And one of the biggest risks is inflammation of the lungs, which occurred in about 10% of patients in this study, and a small proportion of those patients had fatal inflammation of the lungs. The second drug that I think is showing a lot of promise, that is not currently available in Australia but may be in the future, is a tablet called tucatinib. This is a study that looked at patients who previously received treatment for metastatic HER2 positive breast cancer. And in this trial, patients received capecitabine, a chemotherapy tablet, and trastuzumab, with or without this tablet called tucatinib. The really important part of this study is that 50% of patients in this trial had brain metastases. And what we can see in the top graph is that at 12 months, the people who received tucatinib had a progression-free survival, meaning their cancer hadn't progressed, of 33% versus 12% if they didn't receive tucatinib. And I think the really impressive thing is at 12 months, in the patients who had brain metastases, 24% of patients hadn't progressed compared to all patients having progressed if they hadn't received tucatinib. This graph shows the overall survival, and we could see that the tucatinib combination also improved life expectancy. At 2 years, 44% of patients who received tucatinib were alive, compared to 26% of patients. And when we look at these numbers, you have to remember that this trial looked at patients who'd had a lot of treatment for their metastatic HER2 positive breast cancer. So these results are quite impressive. Again, we have to take these results in the context of side effects. And we do know that these tablets can cause increased diarrhea, as well as hand-foot syndrome, nausea, fatigue, and vomiting, as well as changes in the liver function tests. The last treatment that I think, the last kind of advance currently in HER2 positive breast cancer is this new entity that we call HER2 low. So these are patients who traditionally would have been called HER2 negative. But when we look at their cancer biopsies under the microscope, they do have a little bit of expression of HER2 when we look at the cancer cells. And the reason why this is important is because this trial, Destiny 4, showed that in these patients who traditionally would have been called HER2 negative, did also derive benefit from trastuzumab deruxtecan compared to chemotherapy. We can see on the top graph, looking at progression-free survival, that meaning time to progression of cancer on the treatment. In the patients who received TDXD, the average time to progression was 10 months compared to 5 months with chemotherapy. Regarding your next question, what would you like to see improve so that it's easier for clinicians to treat and care for patients? I think that there are two major factors. The first the first thing I think that needs to improve is our ability to improve the treatment outcomes and improve treatment decisions for our patients. I think personalization of treatments is really important to select the best treatment for that individual patient in front of you, but also taking into account what the potential side effects of those treatments are and avoiding longer-term side effects. And I think quality of life and focusing on quality of life is really important as our treatment outcomes improve survival and improve the chances of cure. We want to make sure that our patients who we do cure or who live for a very long time with their cancer are able to do that with good quality. And I think ways that we could potentially ways that we could potentially achieve that would be to recognise and treat side effects early, but also using technology for patient-reported outcomes, where we could potentially get your information faster regarding how you're feeling on your treatment so that we are able to act on that earlier. Regarding your question about what advice would I give patients diagnosed with HER2 positive breast cancer and their families, I think it's important to highlight that treatment has come a long way. And certainly from one of the earlier slides, you can see the timeline of development of HER2 targeted treatments in breast cancer. And certainly there are a number of drugs on the way as well. I think clinical trials are really important because that's what continues to advance treatments and improve treatment outcomes for patients. And not only trials of new drugs, but also trials that look to personalize treatments, such as treatment optimization trials are important. I think it would be important when you are diagnosed and trying to consider what treatment right for you, that the treatment decisions are quite personalised. And that takes into account not only what the potential success rates are, but also what the side effects are and what the impacts to your lifestyle might be. And I think better understanding of both short-term and long-term side effects will be important to be able to empower people to make those important treatment decisions. I think that sometimes we get a bit bogged down in the treatment, the side effects of treatment and the physical manifestations of treatment, but actually holistic care is really important, and looking after your psychosocial health is equally as important as looking after your physical health. And utilizing things like psychologists, social workers, physios, exercise programs to try and optimize your quality of life during cancer treatment is incredibly important. And also utilizing support groups as well. And I think, sometimes a cancer diagnosis can be isolating, and you can, and I think knowing when to ask for help and asking for help is really important during your cancer journey. And the last question that you asked me, which is a tricky one, is if I was standing in front of the health minister, what would be my message to them in relation to how governments can help researchers and clinicians support better access, care, and treatment for patients with breast cancer? I think one of the biggest factors for research is accessibility, as well as, we might have a good idea about what we think might be important to study, but being able to get that research project off the ground, but also make it accessible to people who live geographically in geographically different locations is really important. We know that often clinical trials can be held in metropolitan areas predominantly, and that can make it difficult for regional and rural patients to be able to access without having to travel for many hours. And I think being able to improve on that is really important for equity as well as accessibility to research and clinical trials. In terms of care, I think there is a big focus on the medical care of patients, but I also think that we need to focus on nursing care, as well as psychosocial and allied health care as well. We know that maintaining fitness, maintaining function, maintaining your nutrition during cancer treatment is incredibly important, not only for treatment, survival, but also quality of life. And I think that these are major factors that we need to improve on to improve our care delivery. I also think that a focus on survivorship is also important in the future, especially as more people are being cured of their cancer. We want to try and be able to improve the survivorship experience, minimise longer-term side effects and the consequences of those longer-term side effects on general health. And thanks to the COVID pandemic, we now have access to technological aids like telehealth and improved access to hospital in the home. But I still think accessibility is an issue in terms of care delivery, and making it easier for patients and to access cancer care is definitely something that needs to be a focus. That brings me to the end of all of your questions. Thank you for inviting me to speak today. And please don't hesitate to contact me if you have any questions. I will leave my information with the organisers of the forum.